this is Julia with Free Tech, and today we're going to be talking about what to do if you miss your blanket no change recertification period at the end of the year. Every year within October and December, the FDA has what's called the NDC recertification period or the blanket no change recertification period. During this time, you either let the FDA know that you have no updates to your products and they all remain the same, however, they're still on the market. And with that submission in SPL, it'll recertify your products until the end of the following year. If you have any updates, you want to make sure to do those as they happen or by the end of that year in order to update. This update will also recertify your product until the end of the following year. Now, we understand that the end of the year can be a really busy time with holidays, organizational closures, whatever it may be. Sometimes some NDCs fall through the cracks or the entire blanket no change is missed. Do not fret. This happens a lot. The FDA typically sees 15 to 20,000 NDC codes not recertified during that blanket no change recertification period. They also will send out an email about mid-January if you do miss the end of year recertification period to let you know that which NDC codes need to be recertified, or maybe your establishment registration needs to be renewed. Whatever it may be, you will receive an email about mid-January if there were any NDC codes that you missed on your blanket no change, or all of your NDC codes if you missed it entirely. Now, if you're a ReTech customer and you utilize specifically our single source for drug products tool, this will allow you to see an exact play-by-play of what NDCs need to be recertified, where to find them, and how to create that blanket no change. It happens really seamlessly within the system. However, if you're not utilizing single source, a great place to check to see if your NDCs need to be recertified is the NDC directory. So if it's prior to the end of the year, you'll be able to click through each of your products and see their certified until date. If you miss your blanket no change and you also maybe miss that email from the FDA until mid-January, they will remove the NDC codes from the NDC directory. However, they'll put them into a separate list in the NDC directory called the inactivated NDC code list. So if you're really not sure and it's about February or March and they say inactivated on DailyMed, you can go ahead and check that list. That is located in a separate section of the NDC directory. Now, to recertify your products, you'll have to do a conversion back into SPL to update the set ID, the core ID, and the version numbering. And that'll be resubmitted to the FDA, and it'll recertify your product until the end of the following year. So if today in 2025, I update my product, it'll be recertified until the end of 2026. I recommend always marking your calendars in October to go through that check of your NDC codes to make sure everything is in good standing. And again, if you utilize our single source for drug products tool, it allows you to see an exact play-by-play of all of those NDC codes and exactly what needs to happen. If you miss the end of your reporting, it is okay. Do not stress too much, but it is extremely important to get your files back in good standing with the FDA. You would never want anything to be stopped. Maybe at the border, if you're importing, they will not allow you to ship things in. So it's extremely important to make sure everything is recertified. If you don't want to recertify and you're done selling that product, it's a matter of delisting the drug and including a marketing end date and the marketing category of completed. Here at ReTech, we're here to help make sure your products are always recertified so that you do not have to go through the process of recertification after the blanket no change period is done. So if you have any questions or concerns or would like to learn more about this service and how we can help get your products in compliance now and always have that general compliance in place, please let me know. You will find my information as well as our pharmaceutical team's information with this video. And thank you so much. Have a great rest of your day.